All right. Welcome to our third training session on the Universal Consumer Information Tool. This is our final online training session, and we are so happy that you're able to join us today. So, Denise, would you like to officially open us up?
You, Courtney, and welcome everyone for joining us. We know that these series of trainings, virtual trainings, have been very important for the network while we push forward with the implementation of the Universal Consumer Information Tool, the consumer assessment. And with us today, I'm very happy to say that she's a colleague here at the department and with a wealth of knowledge and a skill set like no other. And so I want to thank Roberta Farley for being with us and providing this clinical aspect to the Universal Consumer Information Tool training. And before we go to Roberta for the specialty training today, I'm going to go back to Courtney as she goes over a few housekeeping slides here. Courtney?
Great. Thank you so much, Denise. So, as those of you who have joined us in the previous trainings, our housekeeping to let you know is that the meeting is being recorded and it will be posted. So you'll have access to that. The PowerPoint will also be made available to you after this training session is over. I want you to know that you can please turn on your live captions if that's needed. So if you turn on your live captions, you click on the More tab, select Language and Speech, and then select Turn on Live Captions, and that will give you that other assistance with being able to see what's being said. As you can see here, we have our renowned ASL interpreters, and they are going to be spotlighted throughout the presentation. So Megan and Barb, thank you again for joining us. We really appreciate your expertise. And finally, there will be a self-care break about halfway through the presentation. So today we are going to cover the standardization of conducting assessments. So Roberta's going to talk to us about the importance of that. Um, and like Denise said, she really is an expert of all experts. So I look forward to also learning from Roberta. We're going to talk again about really being able to utilize that person-centered approach, which is so critical for the work that you all are doing. We're going to do a deep dive into activities of daily living, lovingly referred to as ADLs. We're going to then do our self-care break. Then after that, we're going to come back and discuss in depth instrumental activities of daily living. So those are the IADLs, because you know everything has to have an acronym. And then the really fun part of today is the opportunity that we're going to have to be able to do some critical thinking scenarios. And I've already looked through them, and I am super excited to be able to see what comes about with those critical thinking scenarios. So, um, and again, we'll review the training schedule and all of that. So thank you so much, Roberta. I am just super excited to be able to be here with you today and learn alongside everyone else.
I am super excited to be here. So if you are ready to get started, I am ready to dig in with my objectives for today. All right, so hello everybody out there. My name is Roberta Farley. I'm the Clinical Operations Manager for Adult Protective Services, part of Aging. Just so you all know a little bit about me and why I am qualified to present or talk on this topic. My background is actually in clinical psychology, but I've been working in adult protection for some time. One of my roles here at APS is quality assurance. the delivery of all kinds of services, of documentation, of tools. One of the reasons for that is because I spent many years providing services as a psychometrician. So I am very adept in research and analysis tactics and methods of research and analyzing data. So that being said, that's what qualifies me to talk to you about research. There's a few other things in my history that qualify me as such. So our objectives for today specifically in regard to our tool is talking about the importance of standardization when conducting assessments, making sure to utilize that person-centered approach that Courtney alluded to a few moments ago in her overview. Then we're going to talk very specifically about activities of daily living. We all know them as ADLs. And then we're going to talk about our instrumental activities of daily living, our IADL. So that's my section we're going to cover. If we can move on to the next slide, please. So we're using simultaneous approaches. So the message that I want to be sure that you all understand as I'm speaking is that these are not approaches that occur in silos or in vacuums. These are simultaneous approaches. So on the one side, you see standardization. And we're going to talk a lot right now about why standardization is important. The first reason is because we're trying to develop and execute consistent methods that have been tested with research. And so what you all know or may not know is that these tools come from a long body of research, right? So before we ever developed ADL or IADL tools, research was conducted, right? By physicians, by psychologists, by different people who are trained in utilizing tools. That leads to our ability to utilize evidence-based decision-making. So when we are utilizing a tool, we're collecting data, right? The purpose is to collect that data. So when we collect data in a standardized manner, it helps to ensure certain things about the tool that we're using and the data that we obtain. A couple of those things that are most important to us, especially in terms of application of research, are reliability and validity. So what we're trying to do is ensure that our assessments are giving both reliable and valid results. So some of you may be very familiar with research principles, and forgive me if I simplify this for you, but some people are not. So reliability in research has to do with the tool's ability to reliably test the same thing over and over again. So if I give this tool to one person, then to a second person, to a third person, are we testing the same thing consistently with that tool across different participants, right? Validity in research, especially on its face, has to do with, are we examining what the tool is supposed to be examining? Okay, so are we actually getting information that the tool was designed to access, right? So reliability and validity are extremely important when it comes to interpreting that data that we're getting and then being able to normalize that data, okay, across populations and make generalizations about things. When we standardize our assessments, the whole purpose in that is to reduce the administrator's bias. So bias tends to be kind of this bad word, and it's not. It's a very natural, normal human tendency. We formulate opinions about things, about the world, about people, sometimes outside of our awareness. We don't even know we're doing that. So by standardizing our methods and our tools, we reduce the bias that we might not even be aware that we're demonstrating, okay? The goal of all of this, the purpose and the benefit of standardization is because we can produce normative data. So we can take that data and we can normalize it across a group of people. For example, males tend to score X, females tend to score this way, people over 65, et cetera, et cetera. Without standardization, we cannot produce normative data. And so why is normative data so important? Well, it's important because data drives policy and drives funding. Okay. So all the monies that we get to be able to utilize this, it depends on the quality of the data and how we're eliciting that information. Okay. But in the same vein, it sounds so cold, right? Research is so cold, and you hear about these double-blind studies and all this where people are not invested in the client. That's not what we want when we're utilizing this tool. So at the same time, while we're standardizing and normalizing all of this data and the tool, we have to be utilizing a person-centered approach, right? So in order to do that, we must be always focusing on the needs of the person, the preferences of the person sitting in front of us, and the values of that individual. When we get into the scenarios later, this is really where you're going to get to exercise a piece of that person-centered approach. Right? In doing that, we honor a person's self-determination. I don't know what the mission statements and values are of all of your different providers and agencies, but I do know that one of our missions is autonomy and self-determination. And I do know that every human being wants to go through life doing things in the way that they want to do things, right? If they're able to do so. So that empowers a person. That self-determination empowers them. And then they can set realistic goals for themselves. So that's the key, is realistic, is to be able to have that conversation about what they can do, what they're not able to do, what they're not willing to do, what they don't care to do. But if we don't meet them at that level in that person-centered way, we can't promote that for them, right? We're also promoting their dignity and their respect as an individual. One of the key things that the person-centered approach will help us to deliver is a positive experience for them. I want you to think about a time that you went to a doctor. I can tell you about one of mine recently. And the doctor didn't seem invested, right, in what you were doing, or whatever provider you were dealing with did not seem invested in the conversation you were having, in the information that you were giving to them. And that's not a positive experience for you, right? So did you want to return to that doctor's office? Did you want to interact with that provider again if you felt that they were not fostering your dignity, right, and respecting your wishes? So we have this balance that we need to achieve, which is between focusing the needs of that person, fostering that positive experience that hopefully is going to lead them to want to continue to utilize services and access resources, and balancing that with using a standardized method to conduct this assessment and to gather the data that we need. So those are the two sides of the coin I want you continuously looking at. Ask yourself these two questions at all points when you're interviewing somebody or you're assessing someone with a tool, any tool, but in particular this tool that we're talking about today. Am I focused on their needs, their preferences, and am I honoring them? And am I collecting the data in a way that is standardized and will help me normalize this data and use it? Okay. If there's any questions about the research aspects of it, or you want more information about these approaches and ways to utilize them simultaneously, I'm happy to do that. Okay, so you can put your questions in, and I'll be happy to address any question about these two topics as we go along through the entire presentation. So now that we've talked about that, Courtney, I think we can move on to the next slide. And I think it's about the time that we got to talk about what you do before the assessment, okay? So that's building rapport. And I know providers often say, I know it's happened to me many, many times when I have a person sitting in front of me and I have to gain information, say, I don't have time. I don't have a lot of time. I move from one client to the next. And I know it's difficult and we're very, very busy. But sometimes just a little bit of small talk and rapport building in the beginning can give you invaluable information that not only will help you to better interact with your client, but also will help you to get truthful, honest, and useful responses, okay, for their care. So we always want to explain the purpose of the assessments and why we're delivering them the way that we are, okay? Just a simple statement like, some of these questions are really simple. They might even sound silly to you, honestly. But we write them this way for a particular reason, because we have to gain a lot of information and specific information. Just explaining why it is the way it is and why we are conducting the assessment can go a long way. It's like if you go into a doctor's office and they start taking measurements and blood work and doing things, but they never tell you what they're looking for. This is the same. It's just on a conversational level as opposed to a physical examination, okay? There's a tendency in dealing with older adults, especially much older adults, to speak to clients in a way that we refer to in the literature as elder speak. Elder speak is a coined term that kind of describes baby talk in a way. And so it's a natural tendency for some people. We don't do it intentionally. It's a bias, actually. So you may hear something like, oh, sweetie, oh, honey, you look so great today. And it has that kind of tone of childlike baby talk. That's elder speak, okay? We want to watch for that and avoid that. Even in some of our most seasoned adult protective services investigators, we hear that. It's just this natural tendency that can come out of wanting to protect people, maybe that are vulnerable, and associating them with younger children or babies, but they're not. They're adults. And what research shows is that it's very disrespectful to them. They perceive it as very, very disrespectful, okay? So watch your language and how you're building that rapport. It'll go a long, long way. When you are delivering the assessment, we want to ensure that we avoid pressuring or hurrying them to answer the questions. Sometimes it's subtle. Ask a question, say you ask about their toileting behavior, okay? And it takes them a second to respond. And we say, are you still there? Are you going to, did you hear me? Can you answer that question? That can feel like pressure to somebody. So one of the things to remember is that normal aging, the brain changes, okay? Especially with advanced age. Those are normal cognitive changes that happens. And one of the things that happens in particular is processing speed slowing. So as we get older, it takes us longer to process information and to formulate speech. Both of those things change as our brain ages. Our brain is deteriorating inside our head. That is a fact of life. And it slows down as we get older. So we have to provide people the opportunity, especially if they're also suffering from any kind of disability, neurocognitive disorder. We need them to have the time to process the information, okay? So we have to be cautious about interrupting, actually not interrupting, and how we are conducting that assessment, especially if we're taking this person-centered approach. It's not very person-centered to hurry or pressure somebody to answer questions. Speak plainly, okay? Everybody here knows what ADLs are and IADLs. Actually, I just made an assumption. That shows you my bias, right? I just made an assumption I shouldn't have made. Maybe people here don't. Maybe they didn't. This is their first time dealing with this and they're getting on this webinar for the first time, okay? Medical jargon, acronyms. The problem with it is that nobody wants to feel like they look dumb, right? Or like they don't know something. So a lot of people will not ask you what those terms mean. So if you say something like, we're going to talk about your ADLs now. If they don't know what that means, the client, they're going to be fearful in some cases to ask, what does that mean? What is an ADL, right? It's kind of like that syndrome in school where the teacher asked you a question, but nobody would raise their hand to answer the question because they were afraid they'd be wrong and look silly in front of everybody. That carries on, right, into our adulthood. Everybody's been in that circumstance. So speak very plainly and avoid medical jargon and technology and acronyms and technological terms. We want to emphasize the practice of cultural humility, okay? There's a lot of people from a lot of different backgrounds. So we're talking ethnicities, we're talking religious beliefs, we're talking sexual orientations, we're talking all kinds of cultural aspects, right? Not just what you can see or you can hear. Think about language, people who may have a different language as their first language. There's all kinds of differences in people's values and their cultural histories that can influence the way that they're going to respond to your assessment. And we're going to talk about that in some of our scenarios later. Really important is knowing about assistive devices. Okay, so if the person is hard of hearing, are they utilizing a hearing aid? Does the person have a visual impairment? If they do, if you're meeting with them face to face, can they see what you're putting in front of them if you're trying to explain something to them for them to read? Okay, so we have to be sure that they have the things in place to be able to properly respond to you. We've seen a lot in the research where the issue isn't really their ADLs. It's that they didn't have a hearing aid in when they were being asked questions, and they didn't understand some of the questions for that reason. Okay, so we can get erroneous information, incorrect information, and then that turns into our data if we're not sure about somebody's functioning at the time of the assessment. So this is important information to have before and during the assessment. The most important thing that I want for you to take from this section, this slide that we're talking about right now, is to focus your attention on the person. I don't care if you're talking to them on the phone, if you're talking to them in person, you need to give them your, as much as possible, undivided attention. So your focus shouldn't be on your iWatch, your coworkers, the television, your computer out your window, any of that. We need to give them our full attention. There's a couple of reasons for that. One is we send messages when we're not paying attention to people. And the message that we send is, I'm more interested in this other thing that I'm doing right now than on the information that you're giving me. There are communication styles that are particularly sensitive to this. And I fall into one of those communication styles. When I am speaking with somebody and having an important conversation with somebody, I expect your undivided attention. If I'm not getting it, I really feel ignored and disrespected. And a lot of our clients feel that way when we're not focusing our full attention on them. Of course, there's going to be interruptions, things that happen, right, in our work life. But we really need to try as much within our own sphere of control to minimize that. The other issue is the more focus you're paying on the client, the more in tune you are to issues. So say you've been going through this assessment and they're doing great and they're responding quickly to things and they're giving you lots of information. And then you get to a certain question and it's crickets. You don't hear anything. They're not responding. There may be an indication of something, but they don't understand the question. They didn't hear the question. They are not comfortable answering that question. Okay. So the more focus you give someone, the better your assessment will be, not just for you, but for the client. They feel paid attention to because you literally are paying attention to them. And you can pick up on subtle cues that you might otherwise have missed when developing your conversation with them, right? This is not a tool that is intended to be handed to a consumer or to a client and taken away and filled out. It is intended to be an interaction, a collaboration. Some of the questions are not straightforward. They require more explanation. They require more prompting from you. And in just taking it home and filling it out, they may become confused. They don't know who to ask about these things, and they definitely can't score it themselves. Okay? And we're going to talk about scoring later. That is probably the most important piece of advice that I can give you, is that undivided attention and ensuring that you are the one administering the tool if that is your responsibility, not the client self-administering it and not another person who's not been trained on it. I worked in a psychologist's office years ago, where they had a secretary up front. And that was her job. She was a secretary. She answered phones, she took appointments, she did scheduling. And when one of the psychometricians was out, this is really unethical of the psychologist, he would hand her the assessments and have her do them. They seem pretty straightforward. We're just asking you how often you've been angry in the last 6 months, how often you've been sad. The problem was she was not trained to deliver that assessment. So a lot of the responses that we would get back from those clients were not effective in their information because she did not know how to properly follow up on questions to deliver the tool. Okay. People need to be trained on utilizing tools like this. And that's why we're all here today, to give you the skills that you need, right? So focus on your client, focus on the work at hand, and you'll be much more successful that way. And your client will be much happier with you, okay, if you do it that way, all right? Okay. I think some questions popped up, and I'm not sure if I need to answer some of those questions right now. If I do, please cue me in. I'll be happy to answer those questions. Courtney, just let me know if there's a question. But in the meantime, let's go ahead and move forward because I think it might be time to get some information from our group and see what our polls are looking like. Yeah, it is. All right. So I'm going to read you the poll question and the answers, your choices, and then the poll will pop up for you to answer. We'll give you guys a minute for everybody to answer that. All right. What is your experience level directly assessing ADLs and IADLs? The choices are, I have no idea what these terms mean. I don't think a lot of people on this call fall into that category. I have a little experience with ADLs and IADLs, or I have extensive experience. So if you can please put your answer in, and we'll give it a few minutes for people to respond. And once I get those results, I'll share that with you. I have a feeling most of the group knows a lot about this. And just in case, I like to know who's in the audience and what their skill set is. And if you have no experience with it, that's fine. That's what we're here for today. If you have a little bit, great. You're going to learn a little bit more. Actually, you're going to learn a lot of it more about administering this tool. And if you have extensive experience, great. The questions have changed. Some things have been reworded. So you're going to get some good skills here today as well. Hopefully some practical skills. So let's wait a little bit longer for people to answer that.
And Roberta, while we're waiting, I wanted to let you know that there are no questions for you right now.
Great. There will be later. So. Right. If you haven't answered your poll question, get your answer in. I feel like I should sing the Jeopardy music or something as we go through this. I'm excited to see the results, like all polls. Once we're done with the poll, we're actually going to go through the survey itself. So the two scales that we're going to cover are both the ADL and the IADLs. We're going to go in depth into every single question. So, ooh, poll results are up. Okay, so, all right, it's a split group. So we have about 5% saying, I have no idea what these terms mean. You are in the right place. Those of you who answered that, you're about to learn exactly what these terms mean. So those of you that have a little bit of experience, which appears to be 44% of the group, you're also in the right place because you're about to have a lot of experience. And then the majority of group, which is what I thought, 52% have extensive experience with ADLs and IADLs. So you're some of our experts here. So you get to ask questions and chime in and help us out through these scenarios, okay? Since you know a lot and you've been doing this for a while. Hopefully you gain something new. It's a good mix, good group, excellent. All right, let's move on. Let's get in it. I'm going to get in the meat and the potatoes now. We've had a nice appetizer, but it's time to move on. Okay. So for those of you that have had no experience with this at all, you brave souls for admitting that and coming here, that's fantastic. So what is an ADL? An activity of daily living. Falls into like 6 major categories, okay? First is ambulating. It's your ability to move from one position to another and to walk. The key word is in all of these, independently, okay? Second is feeding. Feeding is the ability to feed yourself independently. That means being able to put the food in your mouth, eat it, chew it, and do all the things that we call feeding, okay? 3 is dressing. Everything that is involved in dressing, the ability to select clothes, to put the clothes on, okay? And then we have personal hygiene. Personal hygiene is all of the things having to do with how you bathe yourself, groom yourself, brush your hair, your ability to brush your teeth, do your fingernails and toenails. Okay? Some people can do some of those things and not others, right? We found a lot of consumers, they can bathe themselves, but they can't get down to those toenails, right? The 5th category is continence. So this is where medical jargon comes in, and I want you to be a little bit careful about this term, okay? Survey actually used to say this for continence, but a lot of people don't know what that word means. They might know what incontinence means, and they may or may not know what continence means. The ability to control your own bladder and bowel movements, right? With speech, we're going to get into how to phrase this when we get to this question specifically, but a lot of people, if you ask them, are you continent? They may say, what's that? And then you're going to have to explain it. So you might as well just ask the question. All right. The last category is toileting. So that's the ability to get on and off the toilet, to use it appropriately, and to clean yourself and, of course, flush it, like dispose of what's in the toilet. Okay. And we're going to get into each one of these in depth right now. We're going to start with that first ADL. We're going to go through the questions in depth.
Hi, Roberta. There's a question for you in the Q&A.
Awesome.
It says, for these questions, what about when it's considered within a dynamic disability? And the answer is some of the time.
Repeat that because I missed a part of it.
Sorry, I muted myself again. For these questions, what about when it's considered within a dynamic disability? And the answer is some of the time. So
okay.
The answer would be some of the time.
So we're going to get to every individual question that's on this survey, and we're going to give you a complete answer about each one. All right. So if there's one in particular when we get there, that's a great question, by the way. When we get there, let me know, and we can talk specifically about each one, because we're going to go through each one in detail, okay, and what they mean. Some of the time may be independently, and it may not be. It depends on the situation, okay? But I promise you we'll get there. All right, let's get into the first couple of questions. All right, so the first question on the CATS Index of Activities of Daily Living, I'm going to say ADLs now, because y'all know what that means, even those of you that have no experience, right? Is bathing. Do you need help bathing? Okay, and what you're going to see on all of these questions on the CATS Index, that's who this index is named after, who developed this particular set of indices, right? Is independence versus dependence. Okay, you can either do it on your own or you can't. It's a dichotomy, and they're all going to be like this. Okay, so independence is defined as you don't need any supervision to do it, anybody watching you, keeping you safe, any of that. You don't need any direction. You don't need somebody to tell you to do it, how to do it, when to do it. And you don't need personal assistance, meaning somebody to do it for you or physically assist you with the task. To have independence, you cannot have any of those things. You have to be able to do it on your own, okay? That's the dichotomy. So bathing, we're gonna ask them, do you need help bathing? The problem with that question is it's a yes or no question. They may say yes, right? And so what are you gonna ask them next? Tell me what kind of help that you need bathing, right? You'll notice how I phrased that. I phrased it as an open-ended question. Tell me what kind of help you need, okay? Because they've already told you they need help. So we're not making assumptions. They've said, yes, I need help, Okay. So now what? They may say, well, my daughter just watches me outside of the shower in case I fall. Okay. All right. That's very important information. That falls into the category of supervision. Okay. So they're actually not bathing independently. If they cannot stand for that period of time without fear of a fall, without being able to do those things, without having somebody watch for their safety, that's technically not independent. Okay. That falls into the category of dependence. And that is the box we would mark. They need supervision to be able to do that task safely. Okay. Hopefully that makes sense to everybody. As we go through this, all of these questions are going to follow the similar pattern. All right. The problem we have with yes or no questions is sometimes people misinterpret the question, right? So we say, do you need help bathing? And they say no, because maybe she doesn't think that her daughter standing outside is help. Does that make sense to everybody? Maybe she doesn't think that's help. Help to her means she's helping her bathe, she's helping her wash herself, she's giving her the towel. That doesn't meet her definition of help. So even if they say no, we need to follow up. I would follow up with the prompts that are in the question. So example, do you need help bathing? No. Oh, okay. So you're able to bathe on your own without anybody watching, helping you, or directing you. And then you may get a different answer. Yes.
Sorry to interrupt. This is
No,
Joey.
you're great.
So there's another question that I think falls under this particular slide, and it says a consumer that can bathe themselves, but they need assistive devices, so that would be limited. In a case like this, would that be considered dependent?
Excellent question. Beautiful. If you have an assisted device, does not necessarily mean that you're dependent. So let's say we have a shower chair. Okay. A lot of people use shower chairs, right? Because they have problems with their mobility, right? So they use the shower chair. They're able to get in by themselves. They can turn on the water by themselves. They can completely bathe all parts of their body. And this does mean all parts of their body, right? Hair, feet, all of it. And they can do it on their own, dry themselves, get out of the shower. No, then they are independent. We would mark them as independent. The need for an assistive device does not equal dependence. A lot of people are living with disabilities and use assistive devices. Now, let's say on the flip side, they can't lift their leg up over the bathtub to get into it. So somebody has to help them get their leg over, but then they can do everything else when they get in there. That's assistance. So that technically is dependence. I hope that answers your question. And ask all the questions you want moving forward. That's why I'm here. So, okay, great. That's bathing. All right.
Great. This is Courtney.
Yes.
There's a question here that I would like to answer. It says, the form we use also has, in quotes, limited assistance as an option. Are there definitions for limited assistance? So the answer to that question is you're not going to be using that form any longer after October 1st. So that's why this training is so important.
Thank you, Courtney. Perfect. And that being said, we can move on to question number 2 in the CATS index. And excuse me, my allergies are killing me. So if you hear me coughing and stuff.
Roberta, one more follow-up, I think, for this too.
Sure.
This is Joey. So there's a dynamic disability follow-up. What if having a good day, they can do this independent, but some days are harder and need assistance? So how would they answer that?
So generally speaking, they have to be able to do it on their own all the time. Let's say you have a temporary illness. For example, I just had surgery not too long ago, and I needed help for a small period of time to do things. That's a temporary condition. If it's something like that, that's one thing. But if they consistently have bad days, often enough that it would interfere with their ability to bathe regularly, then yeah, that would be considered dependent. I hope that answers your question. All right, number 2. Dressing. Do you need help dressing? All right. Same thing. They say yes. Okay. Tell me what kind of help that you need dressing. They may say, well, I can put my shirt on. And some women a relative of mine could not clip her bra in the back. Okay, so they can do most things, but there's other things that are fundamental to their clothing that they can't do, right? That would be personal assistance. Maybe they can't bend down to tie their shoes, but however, we have slip-on shoes, we have shoes with Velcro. So if you can get shoes on and do those tasks independently, then maybe that's all they need is a modification to what type of shoes they wear. If they can do that on their own and they can do all those things, they're independent. Okay. Now, if they need supervision, once again, they can't balance. They're going to put their pants on and they've fallen. And so they need somebody to help hold their arm where they put their pants on. Okay. That is supervision, right? Where it's direction. Maybe you need to put your underwear on first and then put your pants on in like a neurocognitive disorder type of situation. That is dependence. Okay. Remember, this is dichotomy. They either need help, they don't. They're either independent, they're not. And the same principles apply to asking the question. If they say, no, I don't need help, follow up with, okay, so you don't need anybody watching you, helping you with anything. You can do your shoes, you can button your shirt, you can do it all by yourself. And they say yes, then you've got all the information you need. You can move forward to the next question, just like we're about to do. So we're going to go on to question number 3.
All right. One other question is, what if they can do it by themselves? So this is referring to the bathroom.
Okay.
However, their caregiver feels safe when they're in the bathroom with them. Is that independent or not?
So that's a good question to follow up with. So if they're telling you, we rely on what the client says, right? Because we're person-centered approach. If the client says, I can do it on my own, but they're just worried. The next question I would have is, why are they worried? Like, I would want to know why that caregiver wants to be watching what they're doing. Okay. They say, well, because I've fallen before in doing that activity. Then I kind of have to reassess, can they really do it or not? Because it may be a situation where they think they can do it, but they can't, right? But if they say, no, well, she just says that I shouldn't be doing it by myself. And, you know, I can do it. I've never had a problem. I've never fallen. I've never not been able to do it. Then it may just be caregiver being a little overprotective. And that's okay. There's nothing wrong with that. I'd rather they be overprotective than not and have a neglect allocation with our agency, right? But you're going to have to ask a little bit more follow-up is my point. So if they answer you that way, I can do it, but my caregiver is worried about me, you're going to need a little bit more information.
Roberta, this is Denise. And if we could just let's address one question in the that came in a bit ago about printing these pages for training their staff on the assessment and reassessment. So you will be able to print these pages from the Universal Consumer Information Tool. The department and WellSky continue to address the changes to the tool, and they will be, our goal is to have them in the sandbox for the training on the 18th. But going back to that last question, Roberta, the fact that there's a caregiver, and yes, person-centered question and responses are important with this, and knowing who our consumer is, who our client is. But if we have clients that we know have dementia, Alzheimer's, they have a caregiver, and they're being asked these questions, many times that senior recipient of the service may be saying, yes, I can dress myself, but the caregiver knows and is there providing assistance during this assessment or the bathroom bathing situation. You know, the consumer is saying, yes, I can bathe myself, but the fact that they have a caregiver and it might be an Alzheimer's or dementia client, can you address that? Because I think that also is likely with our audience today coming up as being a needing clarification.
Yeah, absolutely. So I was gonna get there, but Denise is always on it, which I appreciate very much. So the fact that there is a caregiver is an indicator of something, right? But sometimes caregivers are there to do IADLs and not ADLs. So they're there to help them manage medication because they can't do that. Or they're there for very specific tasks, right? Because we all know there are care plans, right? And so caregivers are there to do very specific things based on their needs, right? So just them having a caregiver doesn't necessarily mean they can't do certain things or tell you what they can or cannot do. But specifically with neurocognitive disorders, Alzheimer's type dementia, Parkinson's disorder type dementia, all those kinds of things, we know that there's progressive brain deterioration. So there's a chance they could have done it a week ago and they have declined or decompensated. There's a chance that they think they can do it and they can't. And so if we have a caregiver available to verify that information, sometimes they're in the background going, no, everybody's seen that, right? Where we're asking the client a question and the caregiver's in the back saying, no, that's not true. They can't do it. Okay. So things like this really require more investigation. And that's what I was getting at. If you know there's a caregiver present and you have access to them and permission to speak with that, then that would be a good source of information. But if they're adamant, the person, that they can do it on their own, and this person isn't there to serve them for those purposes, that's what I would ask them. What is your caregiver there for? What do they do for you? What were they hired to do? What are the services you have in place? I hope that helps. Denise, did I answer your question effectively? Or the question that came in?
Yes, thank you, Roberta.
You're very welcome. Okay, for the sake of time, go
right.
ahead.
We have one more quick question. So
sure.
We had the question of, is the scoring correct? Should independence be 0 and dependence be 1? So Roberta, do you want to talk about that or do you want me to talk about that?
We're going to get to the scoring at the end. So we got to get through all the questions first and then we'll talk about scoring. Is that cool with everybody?
That is great. And then I have a little input on the scoring about how it's going to translate within the system.
Awesome. Okay. Beautiful. Because I'm not, the system is their thing. So this is my thing. So, all right. Number 3. Toileting. Do you need help using the toilet? Okay. This was the question that used to say, are you continent? And I know a lot of people, so my grandmother was Spanish as a first language. And if you had asked her that, she had captured most of the English language. She would have been like, oh, no, no sé. And she would have marked whatever on the form. So this speaks a lot to how we ask questions and follow up about them. Okay. So what I want you to remember, it's really important about toileting, is somebody may say, no, I use depends. Like I use depends. I don't use the toilet. Even if they are using incontinence supplies, there's a delineation between independence and dependence. Okay. If they use them because they're afraid they could have an accident, but normally they can toilet. This is the case with a lot of our clients. Okay. They're going to go somewhere, be somewhere for a long period of time. They're not sure how far the bathroom is, and they just want to wear that. And sometimes they have an accident. That's not dependence. Okay. That's not technically incontinent. But if they use it because they cannot control their bladder and their bowel functions, they're urinating in it daily, they're defecating in it daily, that is dependence. Okay. The same thing with assistive devices, like we talked about earlier. If they have a bedside commode, but they're able to get out independently, use that bedside commode, clean themselves properly, then they can toilet independently. Okay. Those are kind of the special circumstances that you'll see on this. Same thing. Do you need help using the toilet? Yes. Okay. Tell me about the help you need. And they'll explain where they're lacking or not. Okay. All right. Number 4. Halfway through, transferring. Okay. This one's usually the most obvious, especially if you're meeting in person. You can kind of see things in people, right? So it's an opportunity if you're meeting in person to evaluate them. Watch how they move. Watch how they get up and down out of a chair, right? Do you need help transferring from one place to another? Even if they struggle, okay, and they have to put their arms on the chair and do the rock, as we call it, where you rock back and forth to get up out of that chair. If they can get up on their own and move to the next place, even with difficulty, they are independent, right? Any assistance with transferring, taking someone's hand, not a device though. If they can use the device on their own, then they are independent transfer, okay? But any assistance at all, even the slightest, to balance anything like that with another person, and they cannot do it independently, means dependent in transfer. All right. Number 5. Continence. Are you able to control your bladder and bowel movements? That goes back to the toileting question, okay? But this is specific to can they control it, okay? So now we're not talking about can they use the toilet or not and clean themselves. Just simply, can they control their bladder, bowel movements or not? It's that simple, okay? It's not really that much more to it. Now, some people have accidents. They have bladder leakage from time to time, occasionally during certain times or events or movements or what have you. But if they generally, most of the time, are able to control their own bladder and bowel movements, then they are continent. They're independent. Same with medical supplies in terms of colostomy bags and catheters. If they can change that on their own, they can change their own colostomy bag and dispose of it and reconnect a new bag, they're independent, okay? They may not be able to control that bowel movement in the traditional way, but they are able to handle those tasks, okay? So that makes them independent. That's a fine line that people sometimes get a little bit confused about. Well, yeah, but they use a catheter, so they can't control their bladder. No, they can't control the release of their urine into the bag, but they are able to dispose of that bag and change it independently without somebody else's help. Then they are independent. And that can be confusing for people. So if you have questions about that, I'm happy to answer that. 6, and then we're done with ADLs, guys, and we can move into IADLs.
All right, we have one question, Roberta.
Sure.
And the question for you to answer is, do we need to record the type of care under the dependence portion?
So in terms of recording it for WellSky, I'll let you guys answer that question. But in terms of knowing your client's needs, I would definitely include any information that you have about that client, because it'll tailor services and needs that they may require. You're not going to remember it, obviously, on every client or consumer that you see, right? But in terms of WellSky, I work a lot in WellSky, but not on this particular tool. So I'll leave that question to the experts about, is there like a note section, or is there somewhere you could record that information?
And yes, so the answer to that is yes, there is a spot to be able to record this type of information. Just like Roberta said, there is a notes section. If I'm remembering it, I believe it's off to the right when you're looking at the tool.
Right. So yes, it would behoove you to keep it for the client, of course, to know that information about them, because where their limitations lie will also maybe bleed into other limitations that they have. So the more you know, the better. But yes, for the data, it sounds like there will be a space for you to record that. And without writing it down, you will not retain that information. So number 6, feeding. And we're talking about eating. So we're not talking about feeding the dog, right? We're talking about feeding yourself, right? So you able to eat by yourself. And that means eat. Put food in your mouth, chew the food, swallow the food, okay? Being able to physically feed yourself and process the food. Same kind of format, it's a yes or no question. So are you able to eat by yourself? And they say, yes, I am. There's a little caveat to that, especially if people speak a different language or maybe are not as cognitively fluid as some of us are, right? They may think you mean to eat alone, right? Are you able to sit in a room alone and eat, right? I can see somebody misinterpreting this question. So hence the importance of the follow-up. okay, so you don't need anybody to feed you. You're able to feed yourself, chew your food, swallow it. Okay. I can see where that question could confuse somebody. Right? That also applies if you're thinking about somebody on a feeding tube, right? So if they're in a hospital, an emergency setting, or even at home in an emergency setting, and they're on a feeding tube, the likelihood is they're probably not doing that themselves, like inserting the food into the tube to feed, right, through the stomach. So little clues, right? If they're in that situation, they're probably dependent, but we're still going to ask because there are situations where people have had feeding tubes for a long period of time for several disorders, right? That they may have not be able to swallow food, pass food through the esophagus, and they actually can do that themselves. If they can feed themselves through that tube on their own without assistance, just having the tube doesn't make them dependent. Okay. All right. We have gotten to the end of ADLs. We're at the halfway point of training. Now we're going to talk about scoring. So we're going to deal with that first, and then we're going to take a break. Okay. So total score for the CAT index. 6 equals high. The patient is independent. That's why they were getting 1s in the independent boxes and 0s in the dependent boxes. A score of 6 indicates full function. 4 is about moderate impairment, and 2 or less is a severe functional impairment. That means they can only do 2 or less of all of these things that are necessary to survive, like feeding yourself, okay? So it's a very simple scoring rubric. You just add up all the independent answers, right? Independent, 1, independent on this one, independent on this one. High is good, low is not on the CATS index. Hopefully that answered your questions about scoring. And then Courtney, I think, had something about scoring in WellSky.
Yes. So before we get to the scoring in WellSky, we had another question come in regarding the feeding. So the question is, does it include cutting food?
That's a different activity of daily living. So if you're talking about like cutting the food with a knife and a fork, that's not actually feeding. That has to do with food preparation, which we're going to talk about in IADLs. And that's a really common question and a great one. I appreciate it. When we say feeding, can you use the utensil and bring the food to your mouth? That's simply eating. I hope that makes sense to everybody.
That makes sense to me. So to answer the question about WellSky, so we are sticking with the way that the developers of the CATS index of activities of daily living, we are sticking to the scoring when you score it. Okay. So yes, 6 is high for patient independent, 0 is low. So what will happen? There is something built into the Universal Consumer Information Tool that WellSky has built in that will translate those numbers into how ACL requires the numbers to look within the state and federal report. I don't know what that is, but we've been assured that the translation of the numbers will work perfectly for us. Okay.
Awesome. Thank you, Courtney, for that. I appreciate that very much. WellSky is kind of a mystery to me, even though I work in like 3 of their databases. I don't know how they translate stuff, but as long as they get it right, that's all that's important. The most important thing for you about this score, other than entering data into WellSky, right, is if your clients got really high scores, full function, that's a great thing, right? But don't think that translates to IADLs, which we're going to get into next. This is the most basic of functioning, right? Being able to feed yourself, being able to use the toilet. So that doesn't necessarily translate into more complicated tasks that we're going to talk about after our little break. If you're seeing 210, that's a fully dependent person. We're talking very severe functional impairment. And so these are things for you to note as the provider in terms of whatever else you're going to be doing with that client regarding services or what have you. Okay. So,
Right.
and I think,
So,
go ahead, Courtney.
I was going to say we had two other questions
Sure.
Before we had to break.
Awesome.
Okay. So, this question says, what if the person can feed themselves on some days, but not others?
Then they're dependent. So if they're having just a bad day for some reason, like let's say what we see a lot with neurocognitive disorders is delirium. So the person may have like a UTI and it's affecting their brain functioning, it's affecting everything in their life. If it's some temporary state, like what we talked about on some of the other ADLs, and like me with my surgery, right? And I just can't do it for these 3 days, but that's a temporary state that's going to resolve itself. That's very different than somebody who one day they can feed themselves and one day they can't. It's a real big red flag if you forget how to feed yourself for a day. That's an innate human ability that you learn as a baby how to take a bottle, right? So the fact that they can't do it even for one day really warrants us finding out, is that a temporary situation or is that something that's consistently happening? So even if it's on one day, off one day, that's consistently going like that, they're dependent. There's a problem there.
Great. Thank you. Another question is, what if you have to cut food for a consumer, but they can feed themselves after it's been cut? Okay. And I know you addressed this a couple minutes ago, that we're going to talk about this within the instrumental activities of daily living.
I'll answer it.
IADLs.
Yeah, no, I'll answer it because it's come up twice, so it's an important question. So,
okay.
Yeah, if they can feed themselves after the food is cut, then they are fine on feeding. It's your IADL. That's a clue now that you're going to have to look at for meal preparation. That means they cannot prepare their food to be fed, if that makes sense. Okay. So they're still independent on eating because they can get the food in their mouth, right? But preparing the food is going to be a problem. And you're already seeing that. So you'll be looking for it, just like we're looking for what's coming next after our break. All right.
Right.
So let's do this. Let's go ahead and give them their 5-minute break. So yep. I'm looking at my clock. It looks like 2:04. So if everybody will be back here no later than 2:10, you get maybe an extra 30 seconds and we'll get started on IADLs.
Yes, thank you so much. And we will start our next session with a question that came in. So thank you all so much. We'll see you in a few minutes.
Stand by. All right, by my clock, it is 2:10. So are we ready to get started, Courtney? Are we back?
Yes, we are. We are. Oh, look, there was my timer.
Thank goodness for those bio breaks, though.
Right, exactly. Thank you all so much. Thank you for coming back. So we had a question prior to our little self-care break that states, if a client does not meet criteria for services within a cluster, will there be a way to print out only the necessary pages for that individual? So I think that the team needs to look at this question unless Miriam or Denise has an answer to this right now. And we will get back with you. Denise, are you okay with that?
With that,
Right,
let's just go ahead.
And answer it now or later?
No, later.
Okay, perfect. Thank you, Miriam. So we will, one thing just to let you all know, we are taking the questions from all of the trainings and developing a frequently asked question document that you're all going to be able to receive. So we'll make sure that that gets addressed. So thank you so much. All right, Roberta, it is back to you, my friend.
Great. We can move forward to the next slide. We're going to talk about instrumental activities of daily living. So that's our IADLs, right? They fall into a few general categories. One's managing finances. So it's anything financial, anything at all financial. Transportation. So it's driving and organizing transportation, because some people don't drive and never have, but can they find a way to get transported somewhere? Meal preparation, which we've already alluded to. That includes shopping for food and other necessary items that they need to cook food, right? Or to prepare their meals. House cleaning and maintenance. So it's cleaning and keeping up of the home and maintenance on the home. So it doesn't mean like somebody's got to be able to, like, I don't know, change their own faucet out. We're not expecting people to be plumbers or anything, but they do need to be able to arrange that service and know how to get repairs, right, done on their home. Managing different types of communication, however they communicate, whatever modalities they use, and then managing medication. That includes obtaining the medication, organizing the different meds, and then physically taking the meds, right? So we're going to get into each question. And as she goes through to the next slide, I'll go ahead and start to explain that these are not dichotomous like the CATS index was. The Lawton-Brody instrumental activities of daily living scale has different ratings for different questions. So that's why the little numbers are here. And this is taken straight out of the manual. Okay. So on some questions, you'll see multiple zeros, meaning that means they're not able to do that at all, that test. On some, you'll see multiple ones. So we're going to have to go through each question for you to see which answer gets a 1 on each particular question. Okay. It'll make sense as we go through it. Okay. Question number 1 is ability to use the phone. Can you use the telephone? And because there are different levels of limitation or different levels of use, you're really going to have to get more information to fill this out effectively. Okay. So there's a difference between somebody who can operate the telephone on their own. That means they look up phone numbers, whether it's in their little old pocket phone book or on their iPhone memory, right? Or do they just dial a few numbers that they have memorized in their head? Do they answer the telephone, but they don't dial it? Or do they not use the telephone at all? Not using the telephone at all is the only response that gets you a 0 on this scale, right? Any other thing that they can do on this particular question gets you a 1. So if they can answer a telephone or if they can dial some well-known numbers and answer potentially, or operate it all independently, then they're going to get a 1 on this scale. Only the only zero for this is they don't use the phone at all. They cannot, okay? There's a reason behind all of the answers to all of these questions. If we're trying to get a hold of somebody in an emergency situation and they can answer that phone, that means something. They recognize that the phone is ringing and they can pick it up if something is happening, okay? So you see the importance now of asking follow-up. So if they say, can you use the telephone? And they say, yes, I can. Then you have to ask, tell me about how you use the telephone. Do you dial numbers? Do you just answer the phone? What do you do with a telephone? And let them respond to that question. And I see Courtney unmuted, so there
yes.
may be.
So we have.
I learned quickly.
Right. So we have 2 questions related to this. So someone asked, cell phone or landline?
It doesn't matter. Good question, but doesn't matter. Any kind of phone at all, as long as they can operate a phone. They're talking about all phones.
So a little clarification on the last question. So the question is, so if they do not have a phone, is that the last answer?
So that is a very good question. You can't use the telephone if you don't have a telephone. So I would mark a 0, does not use the telephone, but then I would have to include in the notes, well, they don't actually have a telephone, right? Because the problem is if we ask, well, when you did have a telephone, that's actually capturing old information, even if that was yesterday. And that situation could have changed from yesterday to today. We don't really know if they can do it today based on the fact that they could do it a week ago or a month ago. Because especially people, like say we have neurocognitive disorder, you can lose things on a daily basis. So I don't feel comfortable saying a person can do something that they can't, they may not be able to do. Does that make sense? But I do feel comfortable saying, well, they don't have a phone and therefore I can't say they can do it for sure. Because we may be overestimating their abilities, and it's better to underestimate and get clarification than overestimate and then not provide a service they need. Does that make sense, Courtney, what I just said?
Yes.
Okay.
Great. So we have a couple other questions that have come in. Is the difference in response options a result of CATS versus Lawton?
No, really it comes down to just the different levels of limitation that they have in gathering that information. CATS is measuring something so basic that this is far beyond what CATS is measuring. This is, now we're looking at, remember I said it was a dichotomy before at CATS, now we're looking at levels of ability as opposed to can or cannot. Hopefully that makes sense to folks.
One other question. They only check one box.
Yes,
correct?
You check one box, and it's the most appropriate answer. So if they say, for example, that's a very good question. If they say, for example, well, sometimes I dial a few well-known numbers, but most of the time I just answer the phone. That's the only thing that I do. I would go with the lesser. They answer the telephone but does not dial. Because most of the time they're not dialing those well-known numbers. So the most appropriate answer would be the one that they do most effectively. And yes, you only check one box. So if you see how it's kind of in levels of response. So they operate the telephone on their own initiative, they look up and dial numbers. Well, the other 2 answers are included in that. They obviously can dial some well-known numbers if they can do all that, and they obviously answer the telephone.
Okay, a couple more questions.
Yes.
What if the consumer can dial out but needs assistance because they have a hard time hearing?
Oh, then that's actually not an issue with the telephone. That's an issue with their auditory capacity. So that would require clarification. because that's actually not what this is measuring then. Remember the idea of measuring what the tool, right? Validity. Are we measuring what we intend to measure? If their issue is hearing, then this is going to be very difficult to get an accurate response. So I don't have a yes or no question for you on that. We have to figure out what they can do when they can hear. You know what I'm saying? When they have their hearing aid in or what have you. That's why I was talking about the importance of assistive devices in the very beginning, because we can't get an accurate answer to this question without knowing that.
Right. So a couple more questions. So regarding the phone response, marking it as does not use and mark in the notes, that's not proper scoring, which is used to be determine their needs and level of service, correct? So let me read it again. Regarding the phone response, marking it as does not use and mark in the notes, that is not proper scoring, which is used to determine their need and level of service, correct?
I'm not clear about the question. I'm so sorry. I don't understand the question, to be completely honest.
Me
so
either.
Maybe you can re-chat it and then I'll answer it whenever it comes back up. Yep. I'm happy to do that.
Yeah. That would be great.
But for the sake of time, do we still have more questions or can we move on?
We have a couple more. Sorry.
Okay, we're good. Okay.
There's another one here is why are there only 2 options for ADLs and 4 for IADLs?
Because it goes back to the idea of on cats, it goes back to when it was formulated. So cats came first. So cats came along as like, okay, we need to figure out if people can do these things. Can they toilet? Can they whatever? Can they, right? And so then later Lawton figured out, and Brody, but Lawton was the first one. There's more to it than just can you do this or can't you do this? Can you do all of these other things? So the tools were developed by 2 different people with 2 different purposes. Katz wasn't even thinking about this stuff before Lawton came along. So Lawton Brody's instrument is actually an addition to what Katz was already thinking about. And remember, they were simply with cats trying to determine, are they independent or dependent? Do they need help or not? And you could consider that a historical flaw, right? This is trying to determine not only if they need help, but what level they need for these advanced skills. I hope that helps.
Yes, thank you. So someone just has a comment, yes. And it could be answered. So nowadays you can't just lift a receiver to answer the phone. You have to press a button. What if someone just picks up the receiver but doesn't push the button?
And they haven't technically answered the phone, right? So like if you don't swipe or press the button, have you actually answered the phone and received the phone call? So that's how I would envision it, is if you pick up the phone, you haven't actually answered the call. So think of that answer as answers the call, but does not doubt. They can receive the call when it's coming in. So that would include having to press the button or swipe or whatever it is you do with your phone.
So our participant that asked the question earlier rewrote it and said, regarding the phone response, marking it as quotes, does not use, and documenting it in the notes, that is not going to reflect properly within the scoring, and the scoring plays a significant role to determine their need and level of service. Is my thinking correct?
Well, if they don't use the telephone at all, then they don't use the telephone at all. So that would be the accurate response.
Okay.
Yeah. Whether they choose not to or they can't, they don't use it for whatever reason. And so there's a problem there. Yeah. So for the sake of time, we do have to move forward, or we're not going to complete. We have 7 more of these to go.
Right, exactly. Forgive me. No, you're good. We have 2 other questions I have not answered yet because they're much more general. So we're going to save those for the end if we have time. If not, my friends, we will make sure that we address the questions.
I will get them answered one way or another, inside or outside of here. Yeah.
Yes.
Shopping. Are you able to complete your own shopping? So this is one of the ones where you see a lot of zeros. There's only one, if that makes sense. And that takes care of all shopping needs independently. If they can only buy small purchases, like they can only get milk and bread, that's not adequate. All right. If they need to be accompanied on a shopping trip, they can't do it by themselves because they can't carry the bags or they can't, whatever the issue is, that's a 0. If they can't shop at all, obviously that's a 0. There's only one point response, and that is they take care of it themselves independently, okay, without assistance from anybody else. All right. So that's shopping.
So we had a question regarding what about online shopping only?
Yep, that counts. So if they can put in their order, get it delivered, and get it into their house, like the Walmart, you know, you have your $10, whatever, $9.95. I don't know, I don't get it, but whatever it is, Amazon, whatever they use, as long as they could get the groceries to their house and get it inside their home, then absolutely they've shopped independently.
Okay, no more questions.
Great. Number 3. Food preparation. All right, this is the one we had all the questions about before. So now this is going to be like easy, right? All right, they can plan, prepare, and serve adequate meals. Okay, and notice there's the word adequate in there. And that means adequate for their nutrition, right? So if all they're eating is crackers every day, that's not an adequate meal. All right. That's the only 1 point answer. If somebody has to supply them the ingredients, like bring the food to their home, and then they can prepare the meal, then they're missing a piece of it that is absolutely necessary, right? If they can heat, serve, and prepare meals, but they do not maintain their diet. So that goes back to the crackers, right? So let's say all they eat is broth, right? So they heat up a bowl of broth every day and that's all they eat, but it is not maintaining the nutritional value that they need. That's a 0. And then, of course, if somebody has to do it all for them, it's a 0. There's only one point answer here, and that is that they can do all those things: plan, prepare, and serve it to themselves, which would include cutting up your own food, right? If there's meat. And then it stops there. If they can feed themselves, that goes back to the ADL of feeding. All right, number 4. Of course, if there are questions, I will take housekeeping. Okay. So this one's one of those ones that has lots of 1s, 1 point answers, okay? This is why you got to really be paying attention when you're going through this. Are you able to complete your own housekeeping tasks, okay? Can they maintain the house alone or with occasional assistance? That gets you a 1. Okay, if they can do it by themselves, but sometimes they bring in the housekeeper or their sister, that's fine. If they can perform light daily tasks, such as dishwashing, making the bed, those are the majority of things that you need to keep a house clean, but dusting, they don't really do. I know a lot of people that live in dusty houses and they don't have any issues with their IADLs. They just don't like to dust, right? One of them. So, but they still get a 1. They can perform light daily tasks, but they cannot maintain an acceptable level of cleanliness, okay? People don't like how clean or not clean their house is. They don't like how clean or not clean their house is. They can still perform light daily tasks. They still get a 1, right? If they need help with all home maintenance, they still get a 1. But if they don't participate in housekeeping at all, that's when they get the 0, okay? And there's a lot of reasons for that. But the biggest one when you think about these questions are having a dirty house probably isn't going to like kill you immediately. Not being able to prepare food well, not being able to get supplies to your home well to cook those meals well, that will cause you significant problems to your nutrition and your ability to function. But your house being dirty or not maintained probably won't. Now, of course, if you have, somebody can argue if there's rats and roaches and all of this, right? But there's people that live in those kinds of conditions and are fine. So that if you have a question about, well, why is that getting 1s and all these other things are getting 0s? We're talking about safety and your ability to maintain your life and your environment. And a dirty home doesn't actually necessarily mean unsafe necessarily. Okay. All right.
So Roberta, we
go ahead.
have two follow-up questions regarding the meals, the food preparation.
Sure.
So they're both regarding being able to utilize the microwave. Okay. So the more specific question is, what if the person cannot prepare a meal, but eats like cans of soup or microwave meals?
Okay. So, like, say they just open the can and eat it cold.
Or use a microwave.
Or use a microwave. Microwave's fine. That's considered food preparation. I know people that live on what we used to call TV dinners. You know what I'm saying? Microwave dinners. As long as they can open the box, read the instructions, prepare it, you know, and it comes out as a meal they can eat. Yep, absolutely fine. The cans issue can be a problem because if the food needs to be prepared in the can, like if it's something that you shouldn't eat without cooking it, I don't know, cookie dough or something that you're really supposed to cook before you eat it, then technically they haven't prepared it. So it depends on, the answer depends is what I'm saying. But like say they like potted meat and they just eat cans of potted meat on crackers and that's a major meal for them, that's considered food preparation. Same thing with making sandwiches. They can open a jar of peanut butter and eat a peanut butter sandwich every day for lunch because that's what they like to eat. As long as they can maintain their diet is the key, then it doesn't really matter how they're eating it. Maybe they just like cold soup. I don't know, you know, but I would ask. So if they say, well, I just eat the soup out of the can, I would say, why is that? Why is it that you don't like heat it up on the stove or cook it in the microwave in a bowl? And if they say, because I can't, then there's the answer. They're not able to do that. So you're going to have to ask a follow-up question in that regard.
Perfect. Thank you so much.
Yeah. Number 5, laundry. Oh boy. Do you take care of your own laundry? And I do know there is a service that does laundry for you. I have considered using it, but I'm very picky about my laundry. So same thing. If they're taking everything to the dry cleaner and they do their laundry and they're paying somebody and they bring it home, that's considered laundry. Okay. If they can get it done, that's what's important. So if they can do all their personal laundry completely, yes, they get a 1. If they can launder small items, like rinse their own stockings, their underwear, some people, you know, will just rinse out their shirt in the sink, that gets a 1. But if they can't do any of their laundry at all, even the bare rinsing stockings and things like that, that's a 0. That means they cannot do any of that IADL and they need assistance. I don't know many people who use laundry services. They're very expensive. So you're not going to come across that very much. But it would be the same as getting food delivered into your home. If they can make it happen, then it's okay. The problem that arises for some people like that is if their financial situation changes and in the future they're not able to afford a service like that, then we have to revisit, you know, can they actually do this on their own? But it does fall into that same category as long as they can get it done. Number 6.
All right, we have a couple questions. So one of these is, it must have been on the previous slide, being number 5 does not coincide with number 4. So I'm going to move the slide deck back 1. So, okay, number 5 doesn't coincide with number 4. I'm not exactly sure. Do you have a good guess on what they're...
I move the slide forward again?
Because this is laundry only has 3 choices.
Yeah, some of the questions only have 3 choices. Some of them have 5, some of them have 3, some of them have 4. That's, each question is different. So,
okay, thank you. All right, so another question is that...
And move forward, Courtney, real quick, because we were on 5. That way I stay on track. Yeah.
Yes, sorry. I apologize.
Okay. No worries, no worries.
Okay, so we're back to
laundry.
Eating again.
Oh, okay. Eating.
So a couple more questions came in. So clarification needed. Microwave meals are considered planning, preparing, and serving an adequate meal.
Yeah, As long as it has the adequate nutritional value that that person needs, then yes, as long as they can heat it up and prepare it for themselves and get it ready, then yes, they have adequately prepared a meal.
And so that same answer coincides with this next question. I'll just read the question, and Roberta's answer previously is yes, so this one works for that too. So say a consumer cannot stand long enough to prepare a healthy, nutritious meal, but can warm something, they
Yes.
would be considered independent.
Yes, that's absolutely right. And on the thing of standing, I know people that sit on a stool and prepare their meal. Doesn't really matter, or sit at the table to make their sandwich. Doesn't really matter how you do it. All that matters is you can get it done. Whether you're using an assistive device, maybe you're taking your walker in there to do it and you're doing it on your walker. Doesn't really matter as long as you can get it done.
Okay, so we have a question about, and we answered this one earlier, so
Okay.
it is, can more than one answer be marked per question? And the answer to that is no.
No, and I'll explain to you why. The maximum answer for this scale is 8, because there are only 8 questions. So if there are only 8 questions and they're 1 point each, you can only pick 1 for each question. Maximum score on this scale is 8. So
yes. So I will answer this next question. It says, and the follow-up question answers are put in the notes. And yes, that is correct. Beautiful. And the laundry question is, laundry should be included in housekeeping, correct?
No, laundry is its own. So housekeeping has to do with cleaning your home and maintaining your home. Laundry is a separate question.
Perfect.
Yeah. On this scale that we're including. Now, in the grand scheme of things, yeah, laundry would be like a housekeeping thing you do. Of course. Yeah, that makes total sense. But on this scale, to answer these questions, it is its own independent question. All right, number 6, mode of transportation. Are you able to transport yourself where you need to go? Okay, so the 1 point answers are they travel independently, however they do it, whether they drive or take the bus or arrange the Medicaid transportation, whatever they do, if they can do it on their own, it's a 1. If they can arrange their own travel, but do not otherwise use public transportation, that's still a 1 because they can get to their destination, right? If they travel on public transportation when accompanied by somebody else, that's still a 1 because they can still get there. Okay, they might need help getting there, but they can transport themselves. The 0 answers are either their limitation is their travel is very limited, meaning it has to require almost always the assistance of another person via automobile or taxi, but it has to acquire always the assistance of another person, or they don't travel at all. And you're like, well, what's the distinction between travels on public transportation, the 3rd choice and the 4th choice there? Because if they can travel on public transportation, that means they can get to the bus stop, they can get on and off the bus, usually on their own. And so that person is just assisting them with doing those things. But if they can't even get into a taxi or an automobile without somebody else's assistance, that's a different level of limitation. It's a fine distinction, but it's distinct enough that it gets you a 0 score. Okay, it's a whole new level of incapacitation on that particular task. It seems counterintuitive, but it makes sense when you think about what we're actually looking at, which is, could they transport themselves where they needed to go? And if they need minimal assistance, just they need somebody watching, supervising, so to speak, then that's very different than somebody who can't even get into a taxi on their own without the constant supervision of another person. Okay. All right. Number 7. Medications. This one's only got 3. Okay. And there's only one 1 point answer. Only 1 is the good answer. And that is they can do it all. They can take their medication in the correct dosages at the correct time. Okay. If somebody else has to prepare their medications for them, like put it in pill boxes for them, or they cannot dispense their medication at all, that's a 0 answer. And that's because of the safety requirement, right? So medication is vital. You don't take your heart medication, you have a heart attack. You don't take your cholesterol. We all know what happens when you don't take your meds. Okay. So being able to take your meds on your own by yourself is pretty vital. That's why it's the only number one. Correct doses at the right time. So anything could go wrong there. Okay. So let's say we asked you take care of your medications and they say, well, I do, but I forget a lot. Like I forget to take them. That's when you really have to ask that follow-up, like, okay, like how often do you forget? Oh, well, just every once in a while. Like every once in a while. Okay, all of us forget. I forgot my vitamins this morning. No big deal. But if 9 times out of 10 they're able to do it on their own and they don't forget, then it's okay. But if they're telling you I forget every day, in the evening, I never forget I never remember my evening meds, that's a problem. It's not, first of all, it's not the correct dose. They're not taking the dose they need throughout the day. And second, it's not at the correct time if they're missing it on a regular basis. Okay. So there you go with the need for follow-up questions again. Right. Medications is pretty clear cut. And then finances is also pretty clear cut. There's only 2 1-point value answers on do you handle your financial matters. They do it all independently. And that means banking, whether they bank with checks, cash, debit cards, whether they have multiple accounts or one single account or no account, they go to a payday place and cash their check. However they do it, if they can do it all by themselves and get all their bills paid and everything's taken care of, they're fine. If they can manage their day-to-day purchases like grocery store, gasoline, the necessities, but they need help with other banking or with major purchases, they still get a 1 for that because the most important things are being taken care of, right? Their day-to-day stuff. They're paying their utility bills there, but they struggle when it comes to the annuity statement. They struggle with making a $5,000 purchase for something, okay? It's still okay because they can do their day-to-day stuff. If they can't handle money at all, that's your 0 score. That's your 0. That is all 8, ladies and gentlemen. So I think unless a question has come in about one of these 2, we can move on to some scenarios. Oh, we got to go through the score. I got ahead of myself. I get excited about scenarios. I really love scenarios. Okay, so the scoring is a little different, okay? The total score for Lawton Brody, and if you need the citation, you can go straight to this Merck manual at the bottom. I put the citation, this right out of how this is supposed to be scored. So you can see where all the 1s are, all the 0s are, and you can read the whole research article if you want about why it is the way it is. That is too complex of a conversation to have today. That has to do with statistical analysis and research, and we don't have time for that today. But you can read it if you would like to. A summary score, it's a summary, ranges from 0, which is low function dependent, okay, to 8, which is high function independent. So remember, they got 1 and only 1 answer on each of the 8 questions, which will produce something from 0 to 8. We often represent this in a percentage, okay? So they have 75% independence or they have 50% independence. There's a change here that you guys really need to know about that's important. Historically, okay, this was developed like in the 60s, okay? So historically, people who identified as male or men were not scored on food preparation, housekeeping, and laundry, because historically that generation did not do a lot of those tasks, okay? They may not have done those tasks. The other partner in the home was responsible for those tasks. So what would happen is there was this gender bias where if we were scoring them on those items generationally back then, they looked overly dependent because they weren't doing any of those things, but it was just because they didn't do those things, okay? However, our newest research indicates that the preferred method to score is the entire 8-question scale. They use the terminology 2 genders, both genders, but of course we're inclusive here. So we say all genders, all right? Every person that you assess, regardless of their gender, will be scored on all 8 of these domains. Okay. That is a little different than what people have done historically. So I hope everybody's heard that and understands that. It doesn't matter what their gender is, you will score them on all 8 of these. Okay. All right. Now we can do scenario. Now my
Perfect.
here's your
I'm
template.
going to hold you for 30 seconds because I have a couple questions. So one of the questions earlier was, will we be trained on advanced search to eliminate duplicate clients? So Roberta, this has nothing to do with this presentation, but the answer to that is that your servicing area agency on aging will be providing training on advanced search to eliminate duplicate clients. Okay, so follow up with your AAA on that. And then Denise wanted me to follow up regarding the scoring. Okay, so just to let you all know, this is absolutely and completely different than the ADL and IDL questions that have been asked previously and are currently being asked until the end of this month. So the scoring is completely different than you've ever done when you've been doing these assessments over the however many years you've been doing this. And so I just want to, let you know that we do acknowledge that. And WellSky has done a good job in the versions that we have seen on the Universal Consumer Information Tool to translate this into how it will look normal for you all. Okay, so trust the process, ask as many questions as you need. But the reason we went with these evidence-based tools, the Lawton Brody and the CAT scale, is because they're evidence-based. It's not just we're going to use the questions that we think are going to be able to determine this. So that was a decision that was made at the departmental level. And I just have to say, Roberta, I learned so much from you today. So thank you so much. And I'm going to quit talking so that we can go on with the scenarios.
Fantastic. So my favorite stuff, the analytical stuff. I'm an analyst for trade. So I'm going to read these to you. A poll's going to pop up, but let me read the scenario. And then when we start getting to the options, we can pop that poll up. All right. Mr. Jones is an 88-year-old man who lives with his wife, who is 84 years old. They have one adult son who lives out of state and cannot visit often for financial reasons. You're informed that Mr. Jones has trouble hearing, but is in denial. His wife is concerned as he's not able to do some of the basic things that he used to be able to do. So how will this affect the way you collect your information, right? So here are your options. And I want you to go ahead and put in your answer now. I would do nothing different. I just ask the questions on the survey. Okay? Or I would consider the fact that his hearing might be impaired, affecting abilities, and address that appropriately with him. Or I wouldn't do the assessment because he cannot hear well. Put in your answer. And then this will pop up eventually. Sorry, couldn't help myself. I'm a huge Jeopardy person. Anytime there's a poll or trivia, that's the music that plays in my head. I wouldn't do anything different. Just ask the question. Would I consider the fact that his hearing's impaired? Or would I not do the assessment? We'll wait for that result to come in.
Roberta, a quick question came in while you were singing Jeopardy.
Yes.
So the question is, can you have the spouse of the client answer the questions for them?
So generally speaking, no. If the person maintains their capacity and there is no indication that they cannot complete their own survey, then no. It needs to come from them. Now, if there's an issue, they have a communication disorder and they cannot communicate answers effectively to you, or they have a neurocognitive disorder that is affecting their capacity to answer those questions, then yes, a support person can help you answer those questions. So it's going to depend on the capacity of the client.
Thanks for that, Roberta. I'm going to jump in here. This is Denise,
Yes.
and I'm sorry I had to log off for another meeting, and I've rejoined you guys, and this is great. I've seen all of the questions coming in. I just want to address that. Many times our older adults will attend a senior center with their caregiver, and they're asking their caregiver to be part of that assessment process. So I can understand that question and them wanting to get clarification. If that indeed is being asked by the consumer and the caregiver, to have that support person there to assist them. One, because many times we know that they're not being as honest with some of those questions being asked, and their caregiver can assist them through that process of assessment. So I could see that happening. So thank you.
Absolutely. Yeah, it's like what we were talking about before, where you're asking them something and the caregiver's in the back going, no, they can't do that. Okay. So it's going to be person dependent, you know. Now, of course, if they want help, maybe they have memory issues and stuff, of course, we're going to honor that. That's part of the person-centered approach. But trying to get as much direct information out of them is helpful as well. All right, we have the results of critical thinking, scenario number 1. So 92% of you said, I would consider the fact that his hearing may be impaired and address it. Excellent, excellent. Nobody said I wouldn't do the assessment. These are star pupils right here. Nobody said that, because that is the absolute wrong answer. We need to get the information, right? Because we need to get help and services in place. About 8% of folks said I wouldn't do anything different and just ask the questions on the survey. So I'll challenge you a little bit just to say hearing impairment could impair their entire answers to all of these questions. So if you just ask the questions on the survey, knowing that their hearing is impaired or that they're hard of hearing or deaf, you're not going to get reliable answers on all of the questions. So we would want to know the level of impairment and what they're dealing with. And maybe a support person is with them and they can help. And maybe we just need to get their hearing aids in place or whatever the situation is so that we can answer that effectively. So great, excellent. Let's move on to scenario number 2. Mr. Gonzalez is a 65-year-old woman who was suddenly widowed 3 months ago after a 45-year marriage. She and her spouse, John, lived alone and never had any children. Knowing this information, which statement is accurate? 1, your first choice. The information is irrelevant to her ADLs. That's a typo. Her ADLs and IADLs. Maybe this could impact her ADLs, but not her IADLs. Or this could impact her IADLs, but not her ADLs. Or this could impact both her ADLs and IADLs. So I know that one's a little tricky because there's a lot of letters in there. Either it's irrelevant, it affects ADLs but not I, it affects I but not ADL, or it affects both. Those are your choices. Put in your answer and let's see what we get. I think there'll be more variety on this answer. And this isn't one of those like, it depends kind of questions. There is a right answer. Sorry. Is there anything else, Courtney, while we're waiting on answers to the poll?
There were a couple comments and questions regarding the last one, which I think that due to time, we will just answer those ones at another time.
Okay, I'm happy to draft like an email for you guys and answer all the questions if you'd like that we're not able to answer today. Up, here we go. Okay, so 23% of people said this information is irrelevant. Okay. Nobody thought it could affect their ADLs, but not eyes. A few people thought that it could affect eyes, but not ADLs. And 71% of you got the right answer. This could impact both her ADLs and IADLs. Grief can have a tremendous impact on human functioning. If we couple grief with post-traumatic stress, say he was murdered in the home and she witnessed that, or significant depression, that can actually significantly affect a person's ability to do daily tasks. If you are not sleeping, you may not be able to want to do or have the motivation to do certain things. Depression clinically can affect people's ability to function in terms of they will not shower, they will not bathe themselves, they may not eat, and those are ADLs, which is why that is very important information to have, because it may not be that there's anything wrong with her functioning. It may just be she's grief-stricken or depressed and needs treatment for that, but otherwise could function independently. So that was the correct answer. It could impact both. The question is permanently or temporarily. Courtney, for the sake of time, how do we want to proceed? Do we want to continue with the scenarios or do we want to wrap up?
I'm going to let Denise make that call.
Okay.
Yeah, I think some of those scenarios we can pull out for the in-person training for the 18th.
Fantastic.
Roberta,
I'm happy.
And then we can wrap up. Yep.
Great.
Great.
All right. Well, thank you so much. I will go ahead and pass the torch if you want to just forward through the other two scenarios. And moving along, the baton goes back to you guys. Thank you so much for listening to me today.
Yes. Thank you so much. And I think we'll do that this last poll during the live training. Okay, so Miriam, do you want to just review the consumer data life cycle as we wrap up?
I think we've discussed this several times, and we'll talk about it during the live training too, so that we can expedite.
Perfect. Okay. So I just want to point out here on this slide, as you can see, we are well into September and we're practicing with the Universal Consumer Information Tool. We are going to have a live training next week on September 18th. It's in person in Santa Fe. We're holding two separate sessions. 9 to 11 and then 1 to 3. And the address of where this is taking place is here. Then the final session that we're going to hold is going to be virtual office hours, where we're going to be able to have the opportunity to answer other questions that you all have. I think that due to time, we had put together a top 2 questions from previous trainings. However, we're going to punt that for now so that we do not go over time. Like I mentioned earlier, we are putting together a frequently asked question document, and we're going to be able to have that available to you. So all of the questions that you've asked in the last 3 trainings will be a part of that. We will also incorporate the questions that you ask in next week's live training, as well as the question and answer office hours. So Denise, would you like to wrap us up and bid us adieu for today?
Thank you, Courtney, and thank you, Roberta, for all of the very appropriate clinical view of the training on the tool itself. I know lots of people have questions, and it's understandable that when we're implementing this kind of standardized tool to be used with the consumers, there's going to be questions. And we know that the AAAs are collaborating with the department to implement this, and with our target of October 1st of it being live. We know that it's needed in the sandbox. We're working really closely with WellSky to get that pushed through on the sandbox so that it will be live on the 18th. I want to thank you all for attending and participating and having great questions during this process. So I thank you and have a good afternoon.